Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. This is Valley Health Minutes. You know that Valley Health has physicians, but did you know they have a pharmacy? Well, they do. And we're talking with pharmacist Joel Turley today about what services that Valley Health provides as far as the pharmacy goes. Thanks for being here.
Hi.
Let's talk about pharmacy services. What does Valley Health offer?
So currently, Valley Health operates 5 retail pharmacies located in and around Huntington. We have a few in the further reaches into Harts and Fort Gay. Looking to open a new pharmacy in the Pea Ridge area. So they're open-door retail pharmacies that accept valid prescriptions from providers across, within, and outside of Valley Health. We perform most of the same services that your bigger retail chains offer. We have a more limited over-the-counter medication selection compared to some of our competitors, but we provide generally prescription filling services across our chain.
Now you said it's open retail, so you don't have to be a Valley Health patient to use the pharmacy?
Correct. Again, we accept valid prescriptions from providers across the tri-state area. So if a patient is kind of price shopping or looking around to see what other pharmacies that are available, we're open and ready to receive them.
Okay, so medication safety is such a big issue because there are all kinds of side effects. People have young children. Let's talk about what happens when a prescription is called into Valley Health. What are the processes that you have in place to keep things safe?
So initially, prescriptions are received in the electronic system, and they're kind of evaluated for whether they come from a valid prescriber, so making sure that fraudulent prescriptions aren't being sent into the pharmacy. They're then compared to the patient's profile to make sure that they're appropriate and that there aren't any outlying drug interactions. That's all before processing even occurs. After the prescription is processed by pharmacy technicians, then it is filled and eventually reviewed by the pharmacist as a final last check to make sure there aren't any other drug interactions or patient conditions that might interact with the medication and make it not the best option for them. So very patient-oriented and patient safety-oriented with Valley Health.
And once you get that medication home, there are things to think about as well as far as safety goes. What should people be doing in their homes to keep their families safe?
So storage is always a very important consideration when it comes to medications. First and foremost, you want to make sure that medication is stored out of the reach of children. Medicines frequently look similar to candies on the market and could be easily confused by a young child. So making sure that they're out of reach and out of sight of children is a good safeguard initially. And then in consideration of the medication, making sure that the medicine remains potent and clean and safe. Generally, you want to store medication in a cool, dry place out of direct sunlight because those can contribute to breakdown of the medication, so it doesn't work as well or the right way in your body. Storing, most folks think of the medicine cabinet within your bathroom as being a great place to store your medicine. However, if you have visitors, that's somewhat accessible, and if you take hot, steamy showers, then the humidity in your bathroom may be kind of high and can degrade or break down your medicine. So generally, a good place to store medicine is on a high shelf or in a high cabinet within the kitchen, away from the stove, where it's not going to get hot, there's not direct sunlight, and it would stay, cool and out of sight.
Good suggestion. Maybe relocate if you have it in the bathroom right now. What should you be doing if you have medication and you feel like it's causing a side effect? What should you be doing?
So first, you would want to talk to your pharmacist. Your pharmacist is the medication expert. They're going to be able to tell you whether that side effect you're having is related to the medicine you just started, or if it could be signs or symptoms of something else that's going on, and that you might want to speak with your provider about that. Pharmacists are really available. They're in the pharmacy oftentimes longer hours than physicians, and they might be a little bit easier to get a hold of. So as an accessible healthcare personnel, pharmacists are very available.
Answer all your questions if you have concerns, right?
Right.
That's good to know.
That's what we're here for.
I like that. All right. Thank you so much. Pharmacist Joel Turley with all kinds of answers for us. Thanks for being here for Valley Health Minutes. I'll see you next Monday.